This whole glasses thing was not thought through. Hey guys, what's up? Welcome back to my channel. My name's Taylor. I have cystic fibrosis, and today I want to talk about what exactly that means. Now, I know that I've talked about different aspects of CF in my past videos, but I've never really talked about CF as a whole. And in preparation for this video, I watched several other videos made by CFers explaining what it is. But none of them really talked about what's happening on a cellular level that causes the problems related to CF. And growing up, that was always what I wanted to know. I wanted to know why I had to do all these treatments and what was causing all of my symptoms. So over the years, I've done a lot of research on CF, and I am confident in my ability to explain it to you guys in plain English. In this video, I'm going to address 4 main topics about CF: what it is, how it's treated, how it's diagnosed, and what you guys can do to help. For convenience sake, I'm going to leave time cards to the different topics below so you can skip ahead to the part that you want to know the most. And without further ado, let's get into the video. What is cystic fibrosis? So, CF is a mutation of a gene that codes for the production of a certain type of protein channels in the cell membrane. All the cells in your body are surrounded by a cell membrane. Membrane sort of acts like skin for your cell. It decides what goes in, what comes out, and how much of each substance can move across. Most of the movement of substances or ions in and out of the cells are done through protein channels. In a healthy body, there are enough of all of the different types of protein channels to meet the cell's needs. But in my body and other CF bodies, there's a hiccup in the DNA that causes a problem with the sodium chloride channel. Depending on your mutation, you either don't have enough of the channels or you have defective, malfunctioning ones that don't open like they need to. This means too much chloride is stuck in the cell and too much salt is stuck on the outside of the cell. Now, symptomatically, this means that my skin is salty to the taste, which means dogs love me, which is the opposite of a problem. But on the inside of my body, it is a problem. Specifically in areas like the lungs and the digestive tract, where your cells are coated in a thin layer of mucus. In a healthy body, this mucus is thin and watery, and its whole job is to capture bacteria and then move it out with the help of little hair-like structures called cilia. But the imbalance of sodium and chloride in my cells causes them to take in extra water, which makes the mucus on the outside of them thick, sticky, dehydrated, and a little bit salty. Turns out thick, sticky mucus is not as easy to move, and the bacteria gets stuck in the lungs and causes infections. Another major problem area for people with CF is the pancreas. Now, the pancreas produces pancreatic digestive enzymes and insulin. Thick, sticky mucus from the digestive tract can clog the passageways out of the pancreas, so those enzymes can't get to the small intestine where they're needed to break down our food. So basically, my body cannot digest food on its own. Without the ability to break down food, CF bodies are normally deficient in very important vitamins and nutrients, and it's really hard for CF patients to gain weight. The thick mucus can also cause scarring in the pancreas, which makes it hard to produce insulin. This leads us to the most common CF-related diagnosis, CFRD, or cystic fibrosis related diabetes. The diagnosis is so common that reliable sources say around 50% of patients could be diagnosed by the age of 30. I don't have CFRD yet. I actually went through a period a couple years ago where I had to monitor my blood sugars every day because I was becoming CFRD symptomatic. The test came back normal, and it was decided that I don't have CFRD at this point. If you would like more information on CFRD, I'll leave a link in the description below, or you can head down to the comments and let me know, and I'll try to make a video about it. For now, I want to move on to other complications. Now, CF is considered a ripple effect illness. This means that as time goes on, it causes more and more problems in different organs around the body. CF patients have a higher risk of liver disease, kidney disease, immunodeficiency, sinus disease, and a lot of other stuff. And at this point, you're probably like, wow, that sucks. Are you gonna die? This is my least favorite question on the entire planet, because yes, we all will. The life expectancy for CF is around 40, but I know people in their 60s, and I also know people who passed away at 12 or 14. Everybody's different. I don't know any more than you do when I'm gonna die. I don't even know if it's gonna be CF that kills me. I could get hit by a bus. There's no point in worrying about the CF life expectancy because anything can happen. This is also a really exciting time in CF medicine, but we will get to that later. For now, let's talk about how I got CF. Cystic fibrosis is strictly genetic. There are no outside factors involved. No triggers, no nothing. Basically, both of my parents had one copy of the CF gene, which means they were carriers. Now, since you need 2 copies of the gene to have CF, there was a 25% chance of me getting CF, a 50% chance of me being a carrier, and a 25% chance of me not having any CF genes. And it's totally not unusual in houses where the CF genes are present for there to be more than one child that has it, or at least that the other children are carriers. But my family has never been very great with numbers, so I got both CF genes from my parents, and my brother got none of them. Now, because CF is strictly genetic, most people are diagnosed within the first 2 years of life. Personally, I was diagnosed at 6 months old after I was struggling to gain weight and I was making this really weird wheezing noise. Now, if a doctor suspects CF, they normally start with a genetic test on the parents to see if the CF gene is even present. Then they use something called a sweat chloride test to make a more definitive diagnosis. And it's kind of exactly what it sounds like. They take some sweat and they see how much sodium is in it and if it's chloride deficient. So let's move on to what happens after you're diagnosed. Treatment. I want to make it really clear that CF does not have a cure. It's treatable in the sense that it is manageable, mostly. The whole goal when treating CF is to get the mucus with the bacteria in it out of the lungs. We do this by coughing. We cough a lot. Ask anybody who took the SAT with me. To help move the mucus, most CF patients do daily airway clearance through something called the vest. And the vest is literally a vest that you put on and then it shakes your lungs to try to shake the mucus out. There are also other ways to do airway clearance, like exercise and fun little handheld devices like this. There's also a form of airway clearance called bronchial drainage, which is just as fun as it sounds. You basically have someone pound on your back until you cough the mucus out. This is mostly done on infants because they can't fit into a vest or use other forms of airway clearance, which means yes, my parents beat me as a child. But oftentimes adult CFers also use this because it's highly effective. In combination with airway clearance, we often use inhaled or nebulized medications that can open up the small airways of our lungs or help thin out the mucus. I do a nebulizer every day that is literally sterilized salt water. I breathe in salt water for half an hour every day, and it is just as pleasant as it sounds. But sometimes daily airway clearance isn't enough and we have to go on oral, IV, or nebulized antibiotics. A lot of times IV antibiotics are given inpatient, so CF people can spend a lot of time in the hospital. For nutritional health, pretty much all CF patients are on some form of pancreatic enzyme supplement. We have to take these every time we eat or we regret it. Still, CF patients tend to be low in vitamins, such as A, D, E, and K, so a lot of us are on some form of supplement. There's even a CF-specific vitamin that supplements all 4 of those at once. Because our bodies are fighting infections so often, we have a specific diet. And the use of the word diet might be misleading. Most CF patients are on a high-calorie, high-fat, high-salt diet. Also, a lot of patients are actively trying to gain or maintain their weight so that their body has enough fuel to fight. And since a lot of CFers have to take in so many calories every day so that their bodies can keep fighting, there are a lot of nutritional supplements and also feeding tubes in the CF community. Going back to that really exciting time in CF medicine, I am on a drug called Kalydeco that is absolutely a breakthrough drug. It goes in and forces those little sodium chloride channels to open and close more. The drug is only effective for certain mutations, but it still provides a lot of hope in the entire community that these therapies can work. And the next step is finding a way to do the same thing for other mutations. Okay, so if any of you are familiar with CF, you might be waiting for me to mention lung transplants. Lung transplants are pretty common in the CF community, but I want to emphasize that a transplant is not a cure. Every cell in the body is affected by CF, and the transplant really only fixes the lung issues. That being said, the lung problems are a huge part of the disease, and lung transplants change lives. But the reality of the transplant list is kind of awful. Maintaining a spot on the list is hard because you have to be sick enough but also healthy enough. And the surgery itself is really hard on the body, and rejection is always a possibility. I've seen 2 CF friends die after rejecting their new lungs, and I also watched another one die on the transplant list. All of them were under the age of 20. Lung transplants are not a first option. That's why we spend hours every day trying to maintain the lungs that we already have so that we don't have to get new ones. But for some people, it's the only option. Have you ever tried to breathe through a straw? They say that the way that it feels to breathe through a straw is the way that it feels to need a lung transplant. There are thousands of people in this country breathing through straws every day. They need new lungs. And I will leave a link in the description below where you can go sign up online to be an organ donor. I'm an organ donor. I don't know what they'll take of mine because everything sucks, but along similar lines, there will be a link in the description below for the Cystic Fibrosis Foundation, which is a really incredible organization with a lot of reliable information on CF and also opportunities for you guys to donate to CF research. Fundraising and donations for research are so important in the CF community because we are what is called an orphaned disease. Basically, the government does not invest a lot of money in CF research. Life-altering drugs like Kalydeco are only made possible through donations from really incredible people. I'll also leave a link in the description for how you can donate to Make-A-Wish. For the most part, Make-A-Wish is a case-by-case basis sort of thing. They look at the child individually and see whether or not they qualify for a wish. There are a few diseases, and CF is one of them, that automatically qualify you for a wish. So donating to Make-A-Wish does help CF kids. Okay, I think I covered everything. If you have any more questions, you can either leave them in the comments below or go check out cff.org, the link in the description. They have a lot of information. So if you like this video and you want to support a little old CF patient like me, give it a thumbs up. Also, share this video with any of your friends or family or anybody. One of the biggest challenges that we face with fundraising is just awareness and spreading word about cystic fibrosis, because it's an invisible illness and most of us look pretty healthy. And if you're interested in more videos about CF and what it's like to live with CF, hit the subscribe button below. I post every week. Also, leave me a comment below letting me know if you know anybody with CF or if you have CF yourself. But either way, thanks for watching and have a great day. And Bluetooth to help you upload videos and pictures to a laptop or a phone, or even to print them wirelessly. But it also has a micro USB port, which is what I was using earlier. So I think the reason why when I picked it up in the store, I just liked this one so much better is because it has... Ow.